Welcome to Advocate Today. I'm Tracy E. Gilchrist. March is Bi Plus Health Awareness Month, and we're shedding light on the issues facing the Bi Plus community today. I spoke with Dr. Taina Israel, a professor at UC Santa Barbara who specializes in psychology and LGBTQ plus well-being. We discussed the stigma that comes with bisexuality, Project Rise at UC Santa Barbara, and more. Dr. Israel, thank you so much for being here. I just want to begin with some of your background and how you became a specialist in LGBTQ plus issues, specifically by issues affecting the bisexual community.
Absolutely. I've been doing research on LGBTQ interventions, so ways that we can best support LGBTQ folks for the last 25 years.
Mm.
And so bisexuality has always been a part of what I've been doing. But back in 2015, I gave a TEDx talk about bisexuality. And then I got a lot more requests to do things specifically on bisexuality. And it really encouraged me to focus more specifically on this population, which is so vulnerable and so underserved. And so I've been doing more research, but also I've been teaching an undergraduate course on bisexuality, and I've been involved in advocacy efforts at all kinds of levels, including the federal level, to try to make sure that bisexual Americans have the support that we need.
Wonderful. Well, thank you for that background. And I wonder, would you talk a little bit about the importance of having a Bisexual Health Awareness Month and why it's so necessary?
Absolutely. So a lot of people would have that question. They're like, why do we even need this? So the
Mhm.
first reason is that there are a lot of bisexual people. So bisexuals are actually the majority of the LGBTQ community. There are more bisexuals than lesbians and gay men put together. And transgender people are also more likely to be bisexual than monosexual.
Mm.
And so a lot of bisexual people, and we see even generationally that's increasing. So, whereas about 4% of the US population is bisexual, 15% of Gen Z adults are bisexual. And so it's a large and it's a growing population. But also it's a population that has considerable what we call health disparities.
Yeah.
So bisexual people are particularly vulnerable to things like depression, anxiety, suicidality, alcohol and drug use. And a lot of that is because of the stressors that are on bisexual people.
Mhm. Well, thank you for that. You kind of anticipated a little bit of the direction that I was going. I pulled some stats from the task force regarding intimate partner violence, depression, rates of suicide, which are much higher for bisexual folks than for lesbians or gay men. Uh, Not even looking at the straight population. So, would you talk a little bit about what leads to that? Why are bisexual people at that risk?
Absolutely. So bisexual people are more risk. The way that we know that racism affects people of color because there's sort of additional stressors on people. It's the same way that anti-bisexual stigma affects bisexual people. So when there are things like exclusion from not just heterosexual communities, but also from lesbian and gay communities. And so bisexual people don't have very strong sources of support many places, and also receive a lot of negative messages about our own sexual orientation.
Would you talk a little bit about, there's, oh God, I lost track of how many bills there are, anti-LGBTQ plus bills. So on top of dealing with all of this, there's also that awareness of being a part of a community that is under attack. Would you talk about that impact on the bisexual community?
Sure. And a lot of the bills that are coming out right now are specifically targeted against transgender people. And as I mentioned, transgender people are likely to be bisexual. And so there's really an intersection there where for bisexual people to be thriving, we have to make sure that all bisexual people are protected and supported. And so that means we have to make sure that all cisgender bisexual people and all transgender bisexual people are supported. So really, there's a lot of good reason for L and G and B and T and Q people to come together to support each other, because there are those kinds of intersections that mean that we really need to support our whole community to be strong.
Right, right. Well, thank you. And then you're working with a research team for Project Rise. Would you share what Project Rise is about, please?
Absolutely. So, Project Rise is research and interventions for sexual and gender minority empowerment. And as I said, I do intervention research. So I don't only want to know what are the problems that people are encountering, I actually want to know, how do we make things better? And so our team has done things to explore what are the therapy experiences of LGBTQ people. We've also done training for law enforcement, and we've developed an online intervention to reduce internalized stigma. So internalized stigma are the ways that we absorb those negative messages that we hear from other people and actually come to believe those things about ourselves. And that's one of the things that can really affect people's mental health. And so trying to sort of find some of those things that are causing those internal problems for people, the psychological challenges, and change them. And then, of course, we also need to change what we call structural stigma, which is all of the external stuff that people experience. So the laws against LGBTQ people, discrimination that they experience, and then looking at the ways that that gets absorbed psychologically.
Yeah, wonderful. And then I wonder, would you also talk a little bit about resources for people who are struggling, or, maybe not even struggling, they just want to find a community?
Absolutely. The internet has positive and negative things, but one of the really positive things that is that it can provide some community for people who may not be finding it in their own local area. And so there are organizations like the Bisexual Resource Center, which has lots of great information available on their website. There's also, in some communities, people have their own bisexual social groups or conversation groups or support groups. And so AMBI is a place to look for that. Also, if you just like hashtag by Twitter, you're going to find people who are tweeting about bisexuality, and being able to connect in with some of those folks can be really reassuring and supportive for folks who aren't looking around and seeing bisexual people and community really visible. One of the big challenges is that a lot of LGBTQ organizations and resources in local communities don't provide any specific services for bisexual people. So, for example, I started a bisexual discussion group in my local community because there wasn't really anything being offered. And people have come and they've said, this is the only bisexual thing I've ever seen being offered in our community. And so I really encourage people to, one, look on the internet and find those kinds of supportive resources there. But also, if you're so inclined, start something in your own local community that can really serve other people. And certainly for the LGBTQ organizations out there, please provide things for bisexual people. Bisexual people may not be as connected in with LGBTQ community, but part of that is because we're not necessarily doing the things that we need to do to welcome them in.
Right, exactly. So also to the LGBTQ community, the greater community, be good allies, right?
Yes.
Dr. Taina Israel, thank you very much for your time and for all the work that you do. It's critical. I appreciate you sharing your thoughts here. Thank you.
Thanks so much, Tracy.
Thank you again to Dr. Taina Israel for stopping by to discuss BIPLUS Health Awareness Month. And thank you for joining us for this Advocate Today. We're advocating for marginalized communities with our content and coverage. Visit us online at advocatechannel.com or wherever you stream on the Advocate Channel. I'm Tracy E. Gilchrist, and I'll see you next time.